Good afternoon, everyone. Happy Thursday to you. Welcome to the Midday. I'm Art Rascone. Joined today, special appearance, medical news correspondent, Dr. Jen Ashton from New York. Dr. Ashton, thanks so much for joining us again today.
Good to be with you, Art.
Let's talk, of course, about the pandemic and the numbers. The numbers are escalating so very fast. But let's talk about the cases and the importance of the numbers here. If the cases continue to climb like this, and we've seen astronomical number of cases, isn't the real important number, I guess, hospitalizations?
I think that is an important question. And, you know, when people are watching these numbers, it's important to understand that it's difficult to compare apples to apples. You know, every state may have a slightly different testing strategy, different capacity and capability. Sometimes only the sickest people or those with symptoms are the ones presenting for testing. So we might be missing, you know, as many as 90 or 80% of cases just because they have no symptoms or so mild that they don't even go to get tested. But absolutely, you want to keep an eye on hospitalizations because that's what literally affects everyone. If the hospitals are underwater and you're in a car accident, you might not have COVID-19, but you still need medical care. And if you can't get it, that's a problem for everybody.
You know, the case number, at least at this level, is far greater than it ever was during the peak of the pandemic a month and a half ago or so, but yet our hospitalization is a little bit lower. Does that mean that people are recovering faster? That possibly it is not as many being going to the hospital?
I think no one really knows that, and it's important not to try to read the tea leaves here because this is such an evolving and dynamic pandemic. We're still learning a lot about it day by day and month by month. But I think that, you know, some reasons for that may be just that it's affecting a younger population. But I still think we need to understand that just based on how transmissible this virus appears and how severe it can be in some people, we have to take this seriously. And I think that's what we're seeing right now.
Yeah. Lieutenant Governor Dan Patrick today in Texas said we're not going to listen to Dr. Fauci. That was his response to Texas wanting to move forward, at least the government's response, wanting to move forward and continue to reopen. It is reopening, but yet they've scaled back from 75% capacity to 50% capacity in restaurants. But nothing's been closed and nothing's going to be shut down. That's what the governor has indicated. What's your response to that sort of, I guess, attitude?
Well, first of all, I think that in this setting we're in, which is not only a U.S. public health crisis, but a global pandemic and public health crisis, you know, you may not like the person giving you the medical information, but his credentials are impeccable worldwide, internationally. He has about 50 plus years of experience, and his only agenda is people's health and medical condition. Sure. And so as a practicing physician, I'm in the position a lot of times where I'm giving people news they don't like to hear. But, you know, there's a difference between being idealistic and being realistic.
Sure. Let's talk about masks just briefly. The best ones out there, the ones that are most effective, because we've seen the demonstration of some masks where you can cough or sneeze and still it travels quite a distance.
Yeah, we're learning more and more about this. It's called aerosol science, Art. And yeah, there was some interesting simulated data about that, you know, bandanas being the least effective, those triple layered cloth masks, the more layers, the better, being more effective. Of course, you know, the N95s for healthcare professionals, the most effective at not only preventing the spread out, but protecting the person wearing it. But I'm going to be honest with you, Art, my 22-year-old son wears a bandana. I'd rather him wear something rather than nothing, and I think we're at that point now with just anything is better than nothing.
Sure, absolutely. Dr. Ashton, thank you so much for joining us from New York City. Glad you folks are up there doing well. Apparently that epicenter now moving to other areas like Texas, but we appreciate you joining us. Thank you so much. Have a wonderful day. All right, moving forward here, thanks so much for joining us for the Midday. We're going to be back tomorrow. It is the end of the week, so that is nice, but hope you have a terrific, wonderful holiday weekend as we celebrate the great birth of this nation and the God-given rights we have all been blessed with. Have a terrific day.